You know, Mother's Day this weekend.
Yeah.
Enough with the soaps and lotions and that Jean Naté bath powder. They don't use it anyway.
Or additionally,
yeah.
I like that kind of stuff.
Have we got a gift for you to give to Mom?
Yeah, the importance of mammograms, that's what we're talking about today with Tracy Sawyer from the Trinity Mother Frances Ross Breast Center. She joins us in the living room. Welcome, Tracy.
Nice to have you.
Why is it so important for women to go out and get those mammograms?
You know, mammograms is still the first line of defense for detection of breast cancer.
Early detection, the key here.
Early detection is the key. Every woman should have a mammogram starting at age 40 unless there is some high risk factors, and then you need to discuss that with your physician and probably have that earlier. It is so very important to get those mammograms.
A lot of people watching will go, you know what, times are tight. I can't afford it. I can't afford to get sick. You've heard that before. I can't afford to go to the doctor.
But it's
can't afford a mammogram.
Yeah.
But you guys have a special deal though, don't you?
This month, in honor of Mother's Day, $150 for a mammogram.
Wow. And you mentioned high risk factors. What could be some of those to where women should possibly go get a mammogram before the age of 40?
If you have a family history, that would be probably number one. If you have had a previous breast cancer, that would be a risk factor. Ovarian, uterine, cervical cancer, those are all risk factors for breast cancer.
Okay.
Let's talk a little bit about this $150 price, because it's great. It's good for the entire month of May. How do women out there listening, and of course, husbands and boyfriends and sons who have moms who need that? What do we do? How do we get this going?
All you have to do is call 903-531-5300.
Okay.
And they can schedule you an appointment. That would be for any of the Tyler locations, Canton, Lake Palestine, Jacksonville, Winsboro.
Lindale. Yeah.
Lindale,
yeah.
absolutely.
Yeah, and it's a perfect price too. Now, there were some different announcements made on discrepancies on when you should go and get a mammogram. Tell me about that.
About a year ago, I believe it's the U.S. Preventative Health, that organization came out and recommended that women not have a mammogram until they were at age 50, and then they would have it every other year, and that's just really bad press. I'm sorry.
Yes.
And because the countries that do follow guidelines close to that, the women are 4 times more likely to be diagnosed with advanced disease.
We see what's happening over there, the numbers,
exactly.
the mortality rate.
And also, you know, if I had waited until I was 50, I wouldn't be sitting here today.
Oh, wow.
So it is so important. Breast cancer was detected on my very first mammogram. So it is so important to get that.
You're a living testament to that.
I'm a living
You just gave me goosebumps. Wow.
Tracy Sawyer, Trinity Mother Frances, thanks for stopping by. Nice to see you.
Thank you.
Thank you so much.